topic is discussing whether ADHD is a real disorder or just childhood and adolescent behavior. The main symptoms are hyperactivity, not being able to focus, and act without thinking or thinking. This topic is very heavily debated by doctors and psychologists. I selected this topic because there have been many occurrences in my life that have influenced me to discover the world of psychology. And many of my friends are actually diagnosed, so I'm around it all the time, and I can pick up on when they're taking their meds, when they're not. And I also interviewed one of my friends, and he said, I think that ADHD is a real disorder, but I think it could be different for people who do not have it to understand. The differences I notice when I am on my medication for ADHD compared to when I am off the meds is drastic. My hyperactivity is under control a little more, and I have an easier time focusing, especially in school. The fact that there are specific medicines for it that truly help people who are diagnosed with it is pretty convincing that it is a real neurological disorder. There are specific chapters, Chapter 2 with the neuroscience, focusing on the lobes, the brain cortex, and the way that the brain transmits with the neurotransmitters, and also Chapter 10, which is about disorders. That's pretty obvious. My first supporting argument is from the Kids Health, and the site is the most visited site for health, behavior, and developmental from early birth to late adolescent. It's very straightforward and factual about what ADHD really is. It's not very biased, and the main difference they point out about it being a real disorder or not is that kids with ADHD have symptoms that last longer and happen in different environments. Also, it must not be linked to stress. Kids who experience divorces, moving, illness, change of school, or any significant life event that will cause them to act out. And it's important to not misdiagnose. My next supporting is from the ADHD Health. The site is all about understanding ADHD and treating it right. The strongest part about this article is that they give opposing arguments and why they're wrong. An example of this is that a brain scan of a depressed person can be exactly identical to one that has ADHD. This source also talks about the differences in treatment. Around the world, in the US, stimulant drugs are used. In Australia, therapy, diet, educating the parents, and adjustment in school are factors in that. In China, nutrients are more important than putting the child on meds. My next supporting is from the NIMH. It's very trustworthy because it comes from the U.S. Department of Health and Human Services. There have been many studies and experiments, and it's very factual, and little bias is included in the source. The brain maturity is slowed down by an average of 3 years for patients with ADHD. The development of the brain is specifically slowed down in regions for thinking, paying attention, and planning. The brain cortex is also slowed down as well as communication between the two halves of the brain. My next is again from the Center of Disease Control and Prevention. The main concern is that this article is based off of opinions and that the psychiatry is making unscientific evaluations in desperate need to label and medicate people. This article also has two parts, a yes side and a no side, so it can help in determining what the reader wants to believe, either in the yes side or the no side, and what. In this next article from PBS, they did a interview with men, and they are very well known and experienced in fields relating to ADHD and other neurological studies. The first man was Fred Bogman, who was a child neurologist who argues no. Peter Bergen, a psychiatrist, who argued no. Russell Barkley, professor of psychiatry, who argued yes. William Dodson, who was a psychiatrist and argued yes. Peter Jensen, who was a psychiatrist and argued yes. And Harold Koplis, who was a chairman of psychology, who argued yes. The two men who argued no were the strongest because it made it direct to what their argument was. In the interview with Fred Bogman, he is asked why he thinks about the diagnosis procedure, stating that the American Psychiatry Association's diagnostic manual, the DSM, lists 18 behaviors, from which a teacher can check off behaviors she observes in the potential patient or student. Likewise, the parent or caregiver does the same thing. In the current DSM, if one checks 6 or more of the 9, the individual is deemed to have ADHD. The last article is from the health publication. It does a very good job of giving a lot of information on the yes and no side for the reader again. And it's very strong because obviously it gives the yes and no side. There have been different points of views on whether ADHD is a real disorder. Because there are known treatments and medications for real cases that are true. There also have been brain studies in those who have ADHD and in those who don't, and it indicates the abnormalities. But I also believe that the medications are not always needed, and that it can be treated by simply changing someone's daily routine, diet, surroundings, or even the parent's parenting style, which we related to the study of the authoritarian, the authoritative, permissive, and uninvolved. And whether ADHD is a real disorder or not is a discussion that will always arise when discussing this brain disorder.